Although COVID-19 cases in many provinces are notably on the rise, health experts still believe the situation is manageable as long as the hospitalization rate does not spike as well. Meanwhile, a member of an advisory council of experts called on government anew to make booster shots more available to other sectors, especially with millions of the privately bought vaccines set to expire in August. Patrick De Jesus tells us more.
After a sudden spike, the COVID-19 cases in Metro Manila may have possibly peaked according to OCTA research. This is after the decline of positivity rate from 14% on July 15 to 12% on July 17. However, increase in COVID-19 cases continues to be seen in provinces such as Pangasinan, La Union, Cagayan, and Isabela in Northern Luzon, Pampanga, Bulacan, Bataan, Nueva Ecija, Tarlac in Central Luzon, some areas in Calabarzon, and most parts of Iloilo Province in Western Visayas. But OCTA research fellow Dr. Guido David said this is not a cause for alarm.
Mukhang mataas yung 2,000 kaso kada araw. Pero ikukumpara natin noong January, umabot tayo ng almost 40,000 cases in one day. At last year, nung Delta surge, umabot tayo ng more than 20,000 cases in a day.
According to OCTA, the healthcare utilization rate should be monitored, which is still low in NCR at 30%. But the situation in the provinces is different.
Sa NCR, we expect na tataas pa sila, pero sa projections, hindi naman siya abot ng 50%. Pero meron mga regions na nasa more than 50% ng hospital utilization. Kasama dito yung Iloilo Province, nasa 52.1% yung utilization. Sa Bohol Province, nasa 59.9%. And sa Olongapo City, nasa 66.1%. Medyo nakapagtaka nga yung mga ibang numbers dito kasi hindi naman ganun kataas yung mga nakita namin cases sa Bohol or sa Olongapo, pero mataas ng hospital utilization.
The Private Hospitals Association of the Philippines, or PHAPI, also said that situations in hospital are manageable, but they have noticed an increase in healthcare workers testing positive for COVID-19.
Yun po ating mga health workers na nagpa-positive and yung kanilang mga direct contact, halos lahat ay hindi naman na-confine kasi ang kanila pong symptoms ay mild lang po.
In line with this, the importance of booster dose is reiterated, wherein Advisory Council of Experts member Joey Concepcion once again appealed that the rollout of second booster shot should be open to other sectors. He added that 1.6 million doses of AstraZeneca and Moderna COVID-19 vaccines procured by the private sector are set to expire in August.
We're looking at hundreds of millions that the private sector will lose because these vaccines are expiring. Now, remember, the private sector is already done with the first booster because we inoculated our people way back in January, and we're now in June. America is already giving the booster shots to the 50 years old, and now they're reviewing that the second booster can just be given to everybody, you know. So the sense of urgency is quite not there.
In the latest data of the DOH, 71 million individuals in the country are now fully vaccinated, but only 15.5 million were inoculated with booster dose. Patrick De Jesus for The Nation.